Hi, I'm Dr. Toby Moma, your host on Health and Wellness. It's a pleasure to have you on my show today. I want to introduce you to my guest, Dr. Jawan Crump, 30-year-old PhD in education from William Carey University, master's in speech language pathology from Louisiana Tech in Ruston, and a degree in science from the Women's University of Mississippi, Columbus. She's going to be my guest. She's going to be sharing her story of depression, of overcoming anxiety, and now fulfilling her dreams. She's married, she has a son, she's a pastor's wife, and she's living her fantasy, being a wife, a mother, a daughter, a sister, and also being a minister of the gospel. It's a phenomenal story, but most of all, she's going to share what she tells us about speech language pathology, why that is such an important field amongst our children. She works in the Jackson Public School District, and she's going to be educating us on what to do to help our kids. You don't want to miss it. Look forward to seeing you. Jesus is Lord. God bless you. Hi, this is Dr. Tobia, your host on Health and Wellness. Thank you for joining us. Don't touch that dial. We have a great show here with Dr. Jawan Crump. It's going to be awesome. We're sharing about speech language pathology. Dr. Jawan Crump is a doctorate in education from William Carey, master's in speech language pathology from Ruston University, Louisiana Tech Ruston, and then also a bachelor's, I believe, in science. Am I correct? Oh, yeah.
Yes.
From Williams University in Columbus, Mississippi. Awesome individual, pastor's wife, daughter, sister, professional, mother to her son, being an awesome woman of God at 30, pursuing her dreams. I just wanted to bring her on the show to share with us her heart for people and her heart for speech language pathology. Most people call it speech therapy, but really it's speech language pathology, right?
Yes, sir.
Okay, tell us what it is and what they do. I think they use the word speech therapy because it makes it sound like, therapy for speech. But speech language pathology gives it a little longer and more illustrative designation.
You know, I still don't think that the name fully entails everything that we do.
Hmm.
I think speech language pathology is a better term for it because oftentimes when people hear speech therapy, they automatically hear speech and they think of um, children or they think of speech sounds like
I think
abacada.
of strokes when I hear it.
Really?
That's my
Okay.
first thought.
Okay. Well. Okay.
Am I wrong? But you guys are part of the stroke team, right?
Yes.
Later on, yeah.
Yes.
Okay.
So another part that we work closely with is with swallowing and feeding,
Right.
and so that's one part that the speech language part doesn't fully
Oh, right.
grasp.
So that makes sense.
Yes. And then we also work with voice patients.
Hmm.
So that's kind of left out. And then fluency.
I think it's all in the
part.
pathology.
Yes, that's it.
It's all in the pathology.
And then we work with AAC, so assistive technology. So for individuals that can't verbalize what they need to say, we also work with those individuals also. So we work across the gamut: children, adults, feeding, swallowing, voice, fluency, language, cognitive, speech production, AAC, and if I didn't say fluency.
So I've seen people get a master's in communication.
Okay.
And are those speech pathologists? Are those speech language pathologists?
No, those are usually individuals that are focused on like the
Audiology.
communication side, maybe like linguistics, things like that.
So so just clarify, there's speech language pathologist, then there's audiologist, then are there speech therapy assistants too? I don't know if they are.
Yes,
Okay.
yes, there
So
are.
a lot of my clients, a lot of my viewers are confused with all the plethora of names in that same department. So I can tell you for sure that an ENT is a physician
Yes.
who specializes in most times operating on the ear, nose, and throat of the individual.
Yes.
But in that ENT's office, like in my university, we have speech language pathologists, and I'll just share this and then Dr. Crump will come in. What those speech language pathologists do is when the surgeon has said, looks like you have a vocal cord dysphonia or there's a laxity in your vocal cords, he sends that patient to the speech language pathologist for exercises, and they can now help that person regain their voice. That's just one example
Yes.
of what I know they've done. I call it dysphonia, but there's also another word, but there's several words in that
Yes.
same family. So, in your view now, you've given us, so that's my view as a doctor. Tell me your view from the inside as a speech language pathologist. What other roles, apart from just the clinical that I just mentioned, what other functional roles, if you can describe what those people, speech language pathologists, do in those places that they operate in? Like you do schools, some do hospitals, some do, different facets
Okay.
of work.
So we have various settings. Us speech therapists work in just research. Some are in clinics, such as private practice. Some are in the in a university setting, so they are professors and doing research. Some are in school based. Some are in hospitals or in acute care settings. Some are
What do the hospital ones do?
okay.
Just an
Those
example.
those individuals are typically there completing the initial assessments when these patients are first coming in, helping them get stable, whether it is choosing a proper diet plan or whether it is assessing um, what type of speaking valve or what type of working with a I'm trying to think working with a respiratory therapist to see um, what a trach and vent
Right.
team may want to do for a patient
To
or
get her
even
voice back.
choosing a feeding tube. So um, hospital speech therapists work very closely with doctors and other team members to get those patients functional and as quickly as possible back home as fast as possible.
Now, in the school setting, give us an example of your role. I mean, so if you, I'm going to divert a little bit.
No
Did
problem.
you have to, you could have done a doctorate in speech language pathology,
Hmm.
but you chose a doctorate in what education, am I correct?
Yes.
So, does that change your overall? Because I've always thought about, is a speech language pathologist in a particular setting, does he need to do specialized training in that setting? Like if you're in the hospital, do you have to do extra training to be a hospital speech language pathologist, or you're good just because you are a speech language pathologist wherever you are?
Okay, so based off of our accrediting board, which is ASHA, um, ASHA says that once a speech language pathologist has acquired a master's and their three C's, which is a certificate of clinical competence, they say that we are um, and full understanding of what they are doing. So knowing that they are competent and fully trusting in what they're doing. Um, they are ready to work in whatever setting they are choosing to work in. So you don't have to acquire any extra skills other than um, ensuring that your knowledge is where you are comfortable to work with these patients in these different settings. So coming straight out of a place and knowing that you've only done schools and working and going straight into a hospital, you will need more training
Hands-on.
in
Okay.
a medical setting
Okay.
because you have not done that. But you don't need to go back to school,
So
but
okay.
you may need some continuing education.
Okay. So you came to Ruston. Tell me the bridge between your doctorate in education and your master's in speech language pathology. What was the connection? Is it going to help you in the academic area? Are you going to pursue an academic degree, or is it going to help you in the current workplace in the Jackson Public Schools or in any public school district in the country?
Okay. So what? Once I left, um, once I left Ruston, I went to work in a local school district in Hinds County. And when I went there, I knew that I wanted to do more research because I absolutely love finding out new things. And when I chose to do that, I didn't know what I wanted to know specifically, and so I knew that I wanted to eventually work on a collegiate level, and so I knew that I would have to obtain either a PhD or EDD to eventually work on that level. And so for that, I wanted to get an EDD because I wanted to be more practical
Mm-hmm.
with that, and I knew that I also wanted to teach, and I wanted to know how to teach. So that was the real reason that I went into the educational route of it, because I knew that with my master's I could practice, but then
Right.
I wanted to ensure that I knew how to teach that which I already knew.
Yeah. Wow. So in your current job in the Jackson Public School, are you limited to one school, or do you cover a bunch of schools? How do you operate? Do you operate remotely, or do you have a office, a time with students? What's the capacity of your interaction with those students across the Jackson Public School system?
Well, while I was at JPS, I covered 4 schools,
Oh, you're no
and
more at JPS.
no, sir.
Oh, you're with.
My last day
Oh, okay.
with JPS was last
Okay. I didn't know
week,
that. Okay.
sometime. But yes, um, but I covered 4 schools,
Wow.
and I also served on the assessment team with them, where I assess students for suspected um, disabilities
Mm.
in the greater Jackson area. And so with that, I had certain days that I was at each school where I assessed and treated students, and that was from ages 3 all the way to 21.
Mm. So give us an idea of the students you met, not their names obviously,
Right.
but the conditions you saw prevalent in the school system. Because I think a lot of my viewers they're getting an idea of what you do, but I think if you make it as practical as possible, because a lot of them don't know they have those facilities in schools. Yeah.
Speech language pathologists in schools work very closely with students with autism, and that can be students that appear to be high functioning or students that have severe need. Um, we also have worked with students with language impairment that need help with answering WH questions. Um,
What are WH questions?
who, um, who, what, when,
Okay.
where, why,
Okay.
how questions. How is thrown in there, although it's not a WH, but how to. Also, working with students that have social skill issues. We call that pragmatic issues. So working in small group settings. Also working with students with articulation errors. So they may say K for G, or G for K, or B for P, and P for B. Um,
Mm.
or they may leave off the ends of words, or they may leave off the beginning sounds. And also working with students that may have voice issues, and also working with students that have devices that speak for them.
Wow, that's a pretty exhaustive, and obviously this is an ongoing thing. It's
Yes.
continuous for a couple of years,
Yes.
months, until you see improvement in those kids.
Yes.
Wow. Now, tell me a little bit about um, outside the hospital.
Okay.
What does a speech language pathologist, can they open their own office? Can they have their independent practice? Who do they collaborate with? Are they part of a home health? Are they part of an independent? I've never really seen an independent speech language pathologist, so, but I could just have missed that.
Okay. Speech language pathologists can own private practice. Jackson is filled with them.
Really?
Yes, they have a very large number of them. Um, as long as you are following your business practices of the city and state, having a business tax license, all of that, um, you can operate your own private practice. Um, with that, you obviously have to follow um, different compliances with HIPAA, as 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 well as different.
So you guys get compensated by insurance companies like doctors
Sometimes
do.
that has been one thing that speech language pathologists have had to fight for, is reimbursement for certain services, especially for autism
Mm.
services. And so payment is done via various sources. It could be Medicaid, Medicare, private pay, or a combination.
Like UMC has the K Center,
Yes.
so I guess they have speech language pathologists in the K Center.
I have never been to the
Okay,
K Center, but
okay,
I imagine that they may have one on their assessment team.
okay. Interesting.
But they do
I'm
have
just
a great
curious if
team.
they pay, like therapists, they pay them per hour.
Okay.
That's psychotherapists.
hmm
Do you think that's how speech language pathologists are paid?
I know some services are time based and some are service
Okay,
based.
okay, interesting. So tell me, when you were here in Ruston, were you exposed to any speech language pathologists
Yes.
in the private sector? Not the lecturers, not the professors.
Um,
Because I didn't know any speech language pathologists while I was here in the Monroe area.
okay, so I didn't know any that were private. Um,
They were all employed by the hospital.
they were not employed by the hospital. They were employed by different companies,
Okay.
or employed by the school district.
Okay,
But I
okay.
do know of some currently via Facebook, not in the Monroe area, but there is a company, I can't think of its name, but it was recently opened, and it's in the Ruston area.
So do you think 50% of speech language pathologists end up in the school system?
Oh, yes.
You think more, that the majority end up in the school system?
Yes, I was reading some stats that ASHA posted not too long ago, and the majority of speech language pathologists are school based.
Really?
hmm
So very few in the hospital setting then. I mean,
Yes.
not that many. Financially, obviously, I'm sorry to say that, but they make it look like teachers are the least paid. Does that affect the speech language pathologists who work in the school system?
It does.
So those who work in the hospitals may get more reimbursement
Definitely.
than the school based.
Definitely.
You think
I
so?
can
Or you
speak.
know so?
I can speak from Mississippi. I know that speech language pathologists are on a teacher pay scale. They are given, once they receive their C's, they are given a supplement.
Okay.
But it is not equivalent to the pay that the
Okay.
medical based
So what would
speech.
you talk to that young African American girl in fifth or 10th grade in high school who's thinking of what to do in college? Why would she, like you, when you were 10, 15, 16, or 17, pursue a career in speech language pathology? What will be your spill, your remarks, your inspiration to tell her you can do it? What do you think the future looks like? Why do you think it's a future, it's an occupation, a profession that's worth going into in 2020?
Um, I would start by telling her, "You, my dear, can do it. Um, this field is very rewarding. It is one that less than 5% of all speech language pathologists are African American. Yet, such a large percentage of individuals that receive care from speech language pathologists um, are African American. And it is important that those that receive care see people that look like them. They are able to understand you. You are able to understand them, and you are able to provide a level of care for them that is genuine and that is very sincere and um, push forward. Know that there are less than 20 HBCUs that offer speech language pathology with a master's degree, and I encourage you to aim, knowing that you can go and be a part of these institutions that are aiming to educate African Americans and that are pushing forward um, to be to be the change, and you
Mm.
can do it. And so go out there, do
So
it.
I'm going to be the advocate for the viewer, and this viewer is telling Dr. Crump, it's too hard.
No,
It's anatomy. I hate anatomy. It's physiology. I can't stand all that chemistry and physics and biology. It's too hard. I want to just do something easy and make enough money to keep my family happy. Why should I go put myself through 6 years of college, get a student loan of 100,000 plus, go through night and day studying when my friends are going to go out, get a business degree, and become 100,000 plus earners in 2, 3, 4 years? Why do a 6 year degree when you guys don't earn much more than the guys with a business administration degree? Why should I pursue science, which is more difficult in some people's eyes, than a economics degree that to some people is easier? It depends on what you look at it from. So this is what she's saying on the screen. So I'm trying to tell you.
anything worth having, you're going to have to work at it.
But do you think it's difficult? Is it speech language? Is it a difficult course?
It is indeed difficult. I
Oh,
will not lie to you and tell you that it is not difficult. But nothing that you do is going to be easy. For the individual that got a degree in economics or got a degree in business, it was likely difficult in some way. There's absolutely nothing that is simple, that is easy, that is worth having. Um, there, there will be something that will challenge you, but when it challenges you, you are learning something new, and you should challenge yourself to learn something new every single day. And just like individuals that you say, oh, that's simple. Well, just like it's simple to go and get that degree, it's simple sometimes for robots and things to replace those jobs. It's not simple for jobs to be replaced where hands-on things have to happen. And medical care jobs, medical field jobs, you're always going to need people, and I mean, you can't replace the genuineness of people. So go out there, find what you love, but think of speech pathology because it is a growing field. We need you. And you can always make a difference in the lives of people, children, adults, and you can constantly change where you want to be. And you are making a difference in the lives of people, children,
Wow.
adults, across the scope.
That's awesome. Now, I'm going to advocate for her too. What schools in the area do you know offer speech language pathology? In
All
the
right.
Northeast or anywhere you know, close to Jackson, maybe close to Monroe, close to Ruston, close to Shreveport. Any schools?
All right. So in this particular area, you have University of Louisiana, Monroe.
Right.
That's in Monroe, Louisiana. You have University um, of Louisiana, Lafayette. I know that's
Right.
south, but you also have
Tech, right?
my alma mater, Louisiana Tech. You also have Grambling State
Oh,
University.
Grambling State does it too.
Hmm.
Oh, really?
You have
LSU Shreveport, maybe?
LSU Shreveport, yes.
Okay.
I'm thinking Northern. You also have Jackson State University, which is in Jackson. Um, you have Xavier University
Okay.
in New Orleans.
So Mississippi College.
No.
Okay.
Only ones in Mississippi that offer it are Ole Miss.
Okay. In
Um,
Oxford.
yes.
Okay.
Um, Jackson State, University, oh, University of Southern Mississippi.
Okay. Hattiesburg.
Yes,
Wow.
and Mississippi University for women.
So there's a lot of opportunities in this field. I want you to hear the heart of Joanne. She's going to come back and she's going to keep pouring out her heart till she can convince you to get off your easy believism and your convenience Christianity, where you think everything is a slice of bread and toast. No, that's not how. Jesus said, if you're going to follow me, you're going to take up your cross, die daily. This is not convenience Christianity. This is work. God said you're going to make it happen when you take up your cross. And speech language pathology is going to cost you. You're going to spend time studying. You're going to spend time away from Facebook and Twitter, and you're going to be in the library a lot. But it's going to be worth it. It's going to be worth it. You're going to show your generation that you can make a difference in someone's life. And that's what Dr. Crump has done in her 30 years of life, and I know you too can make a difference. We'll be back next week, and she's going to keep pouring her heart out till we can get you into your destiny. Don't forget, Jesus loves you. This is Dr. Toby Moma and Dr. Crump telling you to join us next week for another time in Health and Wellness with Dr. Toby, discussing speech language pathology. God bless you in Jesus' name. Awesome. Great.